Good morning, everybody. First of all, two things before we even start today. Two things. First of all, happy anniversary. Yes, happy COVID anniversary. It's all been 1 year that we've been living in this life, or living with COVID-19, I should say, in our lives. So happy anniversary to all. Thank you very much for attending. And top of the morning to you all. Happy St. Patrick's Day. Whether you're Irish or not, it doesn't really matter. It's just a day to celebrate. And have a pint of Guinness after work. So happy anniversary to everybody with COVID-19. We've all survived, as well as happy anniversary or happy St. Patrick's Day. We're going to talk about employee benefits. We're going to talk about COVID-19, and it's ironic that it's kind of the 1 year anniversary. And we're going to talk about the biggest thing that I've ever seen in the last 30 years with respect to health, employee benefits, and that's mental health. So we're going to talk about all three of these things today. So I'd like to take this opportunity to welcome everybody. And this is a rescheduled webinar. I was supposed to do this a couple of weeks ago. So those of you that attended that webinar and I had to cut it off without any notice, I appreciate your patience and your understanding. And I welcome you back today. And for those of you that have just joined us today, thank you very much for coming. Unfortunately, when we had this originally scheduled, I found out just before the webinar was about to begin that a very dear friend of mine passed away, Mr. David Brown. He is a long-standing, incredible advisor here in Toronto or in the province of Ontario. And I have been doing business with him for the last 30 years, and he became a personal friend of mine, and I found out that he passed away just moments before the webinar was about to begin. So I couldn't talk about mental health when my mental health was shaken up quite a bit. So those of you that were there, thank you for coming back. And those of you that are just joining us today, welcome. So let's get started. And when we're talking about employee benefits and we're talking about COVID-19 and we're talking specifically about mental health, it's really like an iceberg. This is like an iceberg because, you know what, 10% of it is above the waterline. And 90% of it is below the waterline. And that's what we're here to talk about today, is that 90% that's sort of below the waterline. You can't pick up a newspaper today. You can't pick up or turn on the news at 6 o'clock at night. You can't pick up your phone and look at your news stories or whatever. And there's two things that are first and foremost in your mind when you see these things, and that's number one, COVID, and number two, mental health. Mental health is something that is so important, especially today. And you as a supervisor, you as an advisor, a professional advisor, and advising your clients, I think you can make a difference, and the time is now. You can make an extraordinary difference if you look at things a little bit differently. I think there's an opportunity to add a great deal of value to your clients or to some of your clients right now with very little change in their employee benefit program. But it's the way that you talk, for sure. So welcome to the Benefits Trust. We are a full-service third-party benefit administration company. We were established on January 1st, 1994 by me. So we've been doing this here at the Benefits Trust for 27 years. I've been a licensed insurance advisor, insurance broker, insurance agent, whatever you want to call me, since probably 1988, so quite a few years now, over 30 years. We have a couple of offices now at the Benefits Trust, and again, we are a full-service third-party benefit administration company. One of the things that's important to note is we work with advisors like you. So thank you very much for joining us. We work with advisors like you. We do not sell direct. We have some direct business, that's legacy business, but we don't sell direct. This is what we do, is we help you succeed with your benefit practice. We've been providing this solution since 1994. So we've been around for a while, and as I like to say, we've never made mistakes. We've just had some expensive learning along the way, right? It's only a mistake if you don't learn from that mistake. So I like to say it's not a mistake. It's just really expensive learning. It's called tuition, in my opinion. My name is Robert Crowder. I'm the president and founder of the Benefits Trust. I'm the guy on the right-hand side of your screen. Michael Ignatz is one of our panelists today. He's got his microphone off, his microphone and his camera. That's the word I was looking for, and his camera off. And he's going to be our sort of moderator today. He's running the show behind the scenes. If you have any questions, type them into the chat box. Mike will answer those questions for you if he can. If not, they'll be answered in the remaining time that we have left in the presentation today. or Mike will reach out to you certainly offline. As well as that, Mike is going to send you a CE credit for participating today. You are also going to be signed up for a Trusted Advisor newsletter if you have not been receiving that. We are on, I think it's issue 102. We've been doing this for the last 102 months in a row. So lots of valuable information in that newsletter that you will be signed up for. As well as that, you're going to get a really short survey. The short survey is going to say, you're going to give us some feedback on how we did today and how we can do it better tomorrow. As well as that, you're going to give us some ideas on future topics that you'd like to see covered, or future COVID questions that you'd like to see answered. Feel free to reach out to us at any time. There's our number, there's our email addresses. We also encourage you to visit our website. We have one of those new fancy websites, and that is the, at thebenefitstrust.com. So you can check that out at any time. We encourage you to do that. Let's move right along here. What is an employee benefit plan? Let's start right at the beginning again. And what is an employee benefit plan? And an employee benefit plan is nothing more than a promise. It's nothing more than a promise. And it's interesting because when you use this language, benefit plan is a promise between an employer, a plan sponsor, and a group of employees. And when you use that simple language or very powerful language, it's really not overused. And I use it just about every time I'm in a meeting with an advisor and an end user client. I was using it yesterday. I was using it the day before. I was on Zoom calls with advisors and prospects. And it's interesting when you use that powerful language that a benefit plan is a promise between an employer and a group of employees. You can see the client, even through Zoom, you can see the client, all of a sudden their body language changes a bit and they realize that they've got more control than they think they have. Because me as a business owner and having 30 staff, we can promise them anything that we want. It's up to us as the owners of the business. It's up to me as the owner of the business to say, hey, great, we can promise anybody anything that I want. It's as simple as that. So a benefit plan, when you put it in that powerful language, that very simple language, and it's never overused, it creates a foundation for a discussion and leading into the future. So a benefit plan is a promise between an employer and an employee. The key thing about that word promise as well is it's really understood or easily understood by the person that says yes to you. In other words, the buyer. It's easily understood. Now, most people with integrity, or sorry, let me rephrase that. Everybody with integrity understands the promise and the powerfulness, if you would, of that word. People often don't take that word lightly. So when you say a benefit plan is a promise between an employer and an employee, it's very easily understood by the person that says yes to you, in this case, often the buyer of your services. So I like to start off conversations when we're talking about benefits using very simple language. It works, and it works extraordinarily well. So a benefit plan is a promise between an employer and an employee. Let's keep that, or a group of employees, let's keep that simple language. Let's keep that foundation while we're discussing employee benefits, COVID-19, and mental health today. Disclaimer, before we really get into the meat of this, disclaimer, these are my comments, or these comments are my opinion. This is my webinar. I love to have conversations with anybody who agrees or disagrees. There was a line in the movie or the TV show, The West Wing, which I used to watch many years ago when it was on TV, but I just remember this one line is the president, in this case, Martin Sheen, like to have smart people that disagree with them, right? You like to have conversations with smart people that disagree with them. And it's kind of interesting. We love to talk about benefits. It's what I've spent my life doing, and I love to talk about anything, but this is really, my opinion. This is what I'm reading on the, on the various sources that I get information from, and I've put it together in a format that I think makes sense, but it's entirely, it's entirely my opinion. And as a result of that, pardon me. As a result of that, I hope you agree, I hope you disagree, but I hope you reach out and say, hey, this is where I think you were right and this is where I think you were wrong, because I love to have conversations like that. Market context as well, market comments, my comments today, the context that we're dealing in is really sort of that smaller end of the marketplace as well, sort of that 1 to 100 lives. I think benefit decisions or decisions about benefits or about employee benefits are made differently at different categories of based on the size of clients. We're talking about comments for the sort of smaller end of the marketplace today. I think decisions are made differently in the 100 to 1,000 life size case and 1,000 to 10,000 life case and 10,000 plus life cases. Decisions about benefits are made very differently. So our comments today are my opinion based on information that I've received and experience that I've had, and sort of the smaller end of the marketplace. And I hate to use the word smaller end of the marketplace. I like to say successful business owners with few employees. The reason why I like working in this marketplace, or we at the Benefits Trust like working in this marketplace, well, first of all, there's endless prospects. There's 50,000 businesses in Southern and Central Ontario. I'm in Vaughan right now. I look out and I just see business after business after business. So there's endless prospects, number one. Number two, generally speaking, you're dealing with the owner of the business, so you can get to yes or no really quickly. As I like to say, yes pays you, no teaches you, maybe kills you, without a doubt, maybe kills you. So you can get to yes or no really quickly. The other thing is successful business owners, entrepreneurs that are making money, they like to buy value. They like to buy value. They believe in their product. Generally speaking, they're selling value, but they like to buy value. And you look at yourselves. You are your own business owner. There's, hold on a second, how many people on this call? There's close to 80 people on this call right now. And I think a couple more will join in. But you as a business owner, you are your own business owner, right? You own your my friend Wayne Cowie's on this call, and he's his own business owner, right? Wayne and I were sort of chatting earlier today, or chatting on the chat box earlier, but Wayne's his own business owner. I've known Wayne for many years and we've done business together, but I know he likes to buy value. We talked about some cars that he's bought, and he's bought some real estate in just north of the city. It's about value. It's a value proposition. You like to buy value. You are just like your prospects. Prospects like to buy value. So that's why I like working in this particular marketplace as well. So let's take a dive below the waterline. Everybody can see the 10% that's above the waterline. Let's really look at where we are below the waterline, where there's that 90%, just like that iceberg. And I want to talk about three different components today. And the first one I want to talk about is mental health benefits in its own benefit silo, A little bit of a sidebar. This is probably, in my opinion, the most superb prospecting discussion that you can have right now. It's timely, it's effective, it's unique, and you can show tangible value in less than 10 minutes. So, this is an opportunity for you with your existing clients, but as well as prospecting. And I don't know if you've attended some of the webinars I've done on prospecting and selling benefits during COVID-19, but this is the best time to sell benefits, in my opinion. Anyways, great prospecting opportunity and great way to show tangible value in a very short period of time. So mental health benefits in its own benefit silo. And really, how can this be done for the small case market? How can this be done? Well, it's easy. And we're going to talk about that over the next couple of minutes. So mental health, but where are we today? When I was putting this presentation together, it just absolutely floored me. It really, really floored me. According to Statistics Canada, in 2018, so not too long ago, 3 years ago, 2018, Canadians with excellent or very good mental health, the survey came back at 68%. So close to 70% of the people said they have excellent or very good mental health, right? Excellent. Well, 2020, this was done at the end of last year, 2020. Canadians with excellent or very good mental health, 46%, less than half. Went from 70 to 46. Amazing. 2018, Canadians with fair or poor mental health, the other end of the spectrum. Fair or poor mental health. 8% of Canadians said they're struggling. They've got fair or poor mental health right now. That's 2018. 2020, Canadians with fair or poor mental health, 24%. Quarter of the population saying they have fair or poor mental health. Excellent or good mental health dropped by 22%. Fair or poor mental health increased by 16%. That gap is enormous, right? That gap, that change is absolutely incredible. Less than half of Canadians right now believe they are in good mental health. To me, this is absolutely staggering. And I think to all of you, it would be the same thing. I don't think anybody can disagree with me on this point. This is absolutely staggering. I know I was talking to somebody about this over the last couple of weeks, and they think the numbers are actually bigger than that. They think the problem is bigger. So this is absolutely staggering in the grand scheme of things. And this is the biggest change that I've seen in benefits in 30 years is mental health, and talking about mental health and value being added to mental health. Without a doubt. And the fact of the matter is, I think in the smaller end of the marketplace, this is the biggest area of change I've seen, with little real discussion led by advisors and limited uptake by clients. Yeah, people are talking about it, with large companies. Bell Let's Talk, Starbucks has done something with all of their staff. Walmart has done things with all of their staff with respect to mental health. But it's really interesting. There's been very little real discussion led by advisors and limited uptake by clients in the smaller end of the marketplace. That's what I have found. I'm sure there are pockets of advisors that are doing a lot of work in this area, but most clients that we were talking to that we haven't met before, or prospects that we're talking to that we haven't met before, they're not having these discussions. So when we bring them up, they're going, wow, this is unbelievable. I've never talked about this. So why is this happening? Why is this happening in this marketplace? Well, I got a philosophy on this. Mental health and its own benefits silo. Mainline insurance companies have done very little. This is my opportunity to bash mainline insurance companies, folks. But mainline insurance companies have done very little. They really have. They truly have done very little. Look at Canada Life, look at Empire Life, look at Manulife, etc. They've done very little in the grand scheme of things. Yes, they put some window dressing on some things, but they've done very little. And the answer is really, I kept on looking, going, why have they done very little, in my opinion? Well, because they can't, so they don't talk to you about it. They can't really do much, so they don't talk to you about it. And what do I mean by that? Well, you look at a traditional paramedical coverage wording that's in a contract. And again, I haven't apologized yet, but I apologize for the number of words on this. But this would be a traditional paramedical coverage wording. And if it's not exactly like this, it's something like this. But paramedical cover or paramedical care, like you've got a list of practitioners and a dollar amount in every traditional plan that's out there. And paramedical care means the services of life. It's acupuncture, chiropodist, podiatrist, chiropractor, registered massage therapist, naturopath, osteopath, physiotherapist, clinical psychologist, speech therapist. All right, there's a whole pile of things there, but there is one clinical psychologist that deals with mental health. That's it. One practitioner that deals with mental health. And it's amazing when you think about it, because people need mental health assistance, and they've got an employee benefit plan, and it's the only real opportunity for mental health is dealing with a clinical psychologist. Very small and tight definition. This is traditional paramedical wording. Generally speaking, employers that have 20 employees or 10 employees or 15 employees, that marketplace that we're talking about, you say to the insurance company, we would like to change this. And we would like to put it in its own benefit silo. And the insurance companies, generally speaking, cannot accommodate that type of requirement. They say, no, it's a package and have a good day. Some of the things that we've done at the Benefits Trust, and we've done this a fair amount actually, is we've talked to clients, existing clients through advisors, and we've said, hey, have you thought about creating your own mental health offering, including multiple practitioners, for example? So what we do is we take the clinical psychologist out of the traditional paramedical category, put a mental health category in place, and then we've written wording that looks like this: without the requirement of a physician's recommendation, services of practitioners licensed to provide support services relating to mental health. Providers include, but are not limited to, psychologists, psychotherapists, family therapists, social workers, child and youth workers, not normally resident in the patient's home. The maximum amount of payable of any benefit year is shown in the specifications. So we're saying, hey, anybody that's giving you help that's licensed to do so, we're going to cover you. I was working with an advisor this week, and we are announcing it to their staff next week at their staff meeting, that they put their mental health benefits, we're using wording very similar to this, into their employee benefit program, and they are putting a $3,000 per insured limit for mental health. They believe in their employees, they believe in their families. This is what they are doing, right? That's a powerful message that the employer is sending to the employees. The powerful message that the promise is being delivered to the employees, and they're saying, hey, we care about you, and we care about your mental health and your family's mental health, and we want you to see whoever it is that you need to see. And again, it's, providers include, but not limited to. So making this change, or making a change like this, creates enormous opportunities for your clients, without a doubt. It's saying believe in the employees, invest in the employees, communication with the employees and families. Nobody, I don't care who you are in Canada, if you're an employee of an organization, you know that there's a mental health problem out there. Those stats that I showed you earlier today, really illustrate that. But everybody knows that there's mental health problems because it's all over the news. It's all over the TV commercials. It's all over, I've seen more CAMH TV commercials in the last 1 year than I've seen in my life previously. There's more awareness about suicide, all of these things. So when you are an employer, when you are a plan sponsor, when you are an advisor to a plan sponsor, and you can have meaningful discussions about mental health and how to change and improve their benefit program for their employees, you've got this opportunity to communicate very effectively with your clients, with your clients' employees, and more specifically their clients' employees and their families. So it's a powerful, powerful opportunity. And it creates this opportunity for huge goodwill. Now, some people are going to use it, some people are not going to use it, but it creates this huge goodwill. Any employee would go home and say, hey, to their husband or to their wife or to their children, hey, good news, if anybody needs any help, we now have X thousand dollars to spend on this, and we want to get you the help that you need. If you're having difficulty coping with online school, great, we can have you talk to somebody that will help you through this. If you're having difficulty working from home and not visiting with your adult conversations during the day, so to speak, we can help you with that. Like it's all of these types of things. It creates this enormous goodwill from the employer's perspective and also from the employee's perspective. The other thing is, this is my sarcasm coming out. Yes, I've got a little sarcasm in me. It's that St. Patrick's Day coming up, but the sarcasm. Remember, when successful business owners, when you're talking to them and they come up with this idea, right? And they want to know more about mental health, and they, business owners, successful business owners love to hear the following. Yeah, sorry, checked with the insurance carrier and we can't make that change for you. Yeah, it doesn't work. It doesn't fit in with their systems, right? Business owners hate to hear that. It creates this element of frustration. It creates this enormous element of frustration. When you look at the future ahead, when we look at the future, it's amazing. The rest of the world is changing. They're adapting, and they're flexible, and they're accommodating. And generally speaking, the entrepreneur that's got that business going, with 15 employees or 20 employees or 30 employees, it's all about customization. They're often providing, very flexible and accommodating services. So when they buy services, they want that same type of accommodation, or those same types of accommodations. But sorry, we're dealing with the big insurance company, and they can't do that. Well, that's frustrating. That's frustrating. We're in a period of rapid change. Everything around us is changing rapidly. It's amazing on how quick things are changing. And the question that I have for you, or more importantly, that you have for your clients, when you're looking at adding value, is the insurance industry keeping up with your profitable clients? So look at your most profitable clients. Look at their profitability level, look at how profitable they are in your stable of clients. As we all know, we have some profitable clients for you and some not profitable clients for you. As I like to say, thick files or thin files. Thin files are profitable, thick files aren't. But is the insurance industry keeping up with your most profitable clients, your best clients, however you define your best clients? Are they keeping up? And some might say yes, some might say no. But this mental health component is a significant component and a significant opportunity. In my opinion, is the insurance companies are not keeping up with this. Simple as that. So think about your client's future. What do you want to deliver to them? What do you want to be able to deliver to them? And who is making the promise? Who is making the promise? The insurance company is not making the promise. The business owner is making the promise. It's time to change the promise. And especially to do with mental health, it is time to change the promise. The plan sponsor should benefit from the promise that they are making. There's this opportunity to create the promise, the mental health promise, that is meaningful for the employees. It's meaningful for the employees' families, right? It's meaningful for you, certainly as an advisor making this advice, and they should be able to make that promise that they want, and they should be able to change that promise if they want to. So the benefit plan sponsor, the business owner, can get value for the dollars that they are spending with their employees. So silo benefits in its own silo. Let's move on to the next opportunity. Additional programs and services. Lots of things going on out there. Wellness programs are becoming very popular for smaller clients. Telehealth, enormously popular. Employee assistance programs, more and more popular. Personal prescribing, we'll talk about that, becoming more and more popular. Lots of other services out there. So let's talk about these. And it's amazing because these things historically have really been part of larger employer benefit programs, but with COVID-19, it's accelerated. It's accelerated the awareness and accelerated the uptake on these programs for smaller employers, without a doubt. So there are many additional programs and services that can be added onto or into an employee benefits program. So it's interesting because when you think of an employee benefits program, it's a living, moving thing, but you can link and attach different elements to that employee benefits program to make it even more powerful. But the question is, what program or programs is or are right for the client? And this is something that is vitally important. Which ones are right for the client? And it really depends on the client's mindset and where they want to go. So the key thing is, the client's mindset, but more importantly is where they want to go. It's not where they've come from, it's where they want to go. Where does a client want to go? And I say, don't offer a shopping list of services. It's a waste of time. It's a waste of your client's time. It's a waste of your time. And it's a waste of the provider's time. Shopping lists of services. Oh yeah, I'm going to give them a big giant shopping list and they can choose what they want. And if they don't choose anything, that's fine too. But I've given my client everything so nobody can walk in and say that I've never offered these services. I think it's time to change the advisor-client relationship and don't offer that list of services. I think it's understanding where it is your client wants to go. And to do that, I think it's important to ask future-based questions. Future-based questions. And the best future-based question I've ever asked and ever found in my 30 years of doing business, it came from Dan Sullivan at the Strategic Coach. And if you're not aware who he is, just search the Strategic Coach. He's got lots of material out there. You can sign up for his program or not, but lots of material, lots of great books and articles to read. But the question is very simple. If we were meeting here 3 years from today, what has to have happened for you to say it has been the best 3 years of your life? Ask your client that question. I started off a meeting with a prospect the other day, and I asked this question. And the client went on and on and on for probably about 15 minutes. We didn't even talk about benefits. But if we were meeting here 3 years from today, what has to have happened for you to say it's been the best 3 years of your life? Your client's going to tell you where it is that they are going. It's going to tell you where it is that they're going to go and how they're going to get there. So it's take the time to ask the question and to listen. We're going to grow through product innovation. We're going to grow through collaboration. We're going to grow because our competition is not nimble enough during this pandemic. We're going to grow because our competition is not going to come out of the other side of this pandemic. We're going to grow because we are going to be acquiring 3 of our competitors over the next 6 months. They're going to tell you where it is that they are going, and then you got to help them get there. It's as simple as that. It has nothing to do with benefits. It has to do with the direction and where they're going and the mindset and how they're going to get there. It gives you really a roadmap of where they're going. Another great question that you can ask after you ask that question, how are your current employees going to help you get there? Oh, they're going to get there because they're the best employees, or they're well compensated, or we've kept them busy during this pandemic. We've done additional training. They've adapted. We're focusing on client service, and we're doing client service programs. We're doing all these wonderful things. So another great question is, after the future-based question that we just talked about, if we were meeting here 3 years from today, what has to have happened for you to say it's been the best 3 years of your life? And then they're going to tell you where they're going, and then how are your current employees going to help you get there? Right? They're going to get there by being healthy. What can prevent your employees from helping you with your success journey? Here's where you get the bumps in the road. Well, geez, mental health is a big issue. Terrific. Let's talk about that. Let's talk about preventing or keeping your employees as mentally healthy as possible, so it doesn't get in the way of your success journey. It's asking questions. It's asking future-based questions. And this is a great one. What can prevent your employees from helping you with your success journey? It's a very, very powerful, powerful question. These are a series of questions you can ask your clients and your prospects. What would you like to do to the promise that you're making them with respect to benefits to help them along the way to prevent these bumps in the road? So all of a sudden, you're talking to your clients about the future. You're getting them excited about where they're going. You're talking about how their employees are going to help them get there. You're talking about what's going to prevent your employees from helping with the success journey. And what is it that you want to promise Mrs. Client or Mrs. Prospect with respect to your employee benefit plan? This is the first time we've said employee benefits, and we're just using the word promise here to help them along the way to prevent bumps in the road. Really simple language, really simple questions. You're asking 3-4 questions, and they're talking for 15 or 20 minutes. You're listening. 2 of these, 1 of these, right? You're listening, right? It is a powerful way to communicate with your clients and understand where they're going and where their mindset's at, so you can help them get there. You see where the discussion is going with your client or prospect, and you can see what's important to them, and then you fill the hole with a solution. And when you do that, and when you fill that hole with the solution, the sale becomes really easy. The sale becomes really easy. Simple as that. You fill a hole with a solution, and the sale becomes really easy. You help them with those bumps in the road, or preventing those bumps in the road, and that sale becomes really easy, right? So we're talking about mental health, but we're also talking about sales, right? Let's talk about wellness online. Wellness online, again, COVID has accelerated the uptake down to the smaller end of the marketplace, where clients are looking at bumps in the road, and they're looking at things like wellness, and they're looking at things like EAP programs and so on. Wellness online. A couple of thoughts on wellness online. Employee engagement combined with healthy behaviors during a pandemic. That's really the idea behind a wellness program. It's employee engagement. So that's one thing. You're engaging with your employees on a slightly different level, combined with healthy behaviors during a pandemic. It's easy to sit on the couch and watch Netflix and drink. Lots of people are doing that, eating chips, drinking popcorn, pretzels, whatever, right? But this helps with employee engagement during this pandemic. There are many different programs available, lots available on the on the internet. You can go on your phone and get these things. But I think where I've seen these things work, it's not just buying a program. You need to have employer buy-in with a leader representative. You need to have that employee leader, that employee champion that is leading this charge and getting the employee engagement up. And I think there really needs to be success rewards included along the way. People like successes, just like, dogs, when they're training, you give them a little treat when they sit before they walk across the road to make sure there's no traffic coming. You give them that little reward that comes out of your pocket. Same thing with employees. I'm not by all means saying employees are like dogs. I'm not saying that at all. Please don't write me and email me and saying, you're an idiot. But you got to have success rewards along the way for everybody. And I'm a big believer personally in just lots of, smaller rewards, as opposed to, hey, the individual that loses as much weight as they possibly can, wins a new car. Well, that doesn't make sense, because you want to reward people along the way for their successes. Telehealth. Wow, this is a big change, big, huge change. I've never seen anything change so quickly in such a short period of time in my life, without a doubt, or certainly in my life, in my adult life for sure. But I can't think of anything. Superb programs out there. Quite frankly, I'm a big proponent of Akira. I've used Akira. There's a number of them out there, but I've used Akira personally a number of times. Very, very effective. You get telehealth. You can start interacting on your phone instantly. And you can get in touch with a physician when you need to, or a nurse practitioner when you need to, almost right away by answering a few questions. But you don't have to go to your doctor's office. You don't have to go to your, the emergency room where sick people are, and expose yourself to COVID. If you need a prescription renewal, of whatever the circumstances are, you can go on to telehealth and you can talk to your physician. There are many free and many pay-for-month models available. And it's interesting, there's acquisitions going on left, right, and center. So, there's about 15 of them out there, or more, but, they're being acquired by others. So it's kind of interesting. It's an interesting model and a fabulous model that works. If you're not a member of CGIB, the Canadian Group Insurance Brokers Association, cgib.ca, I suggest you join it. I'm not paid by Dave to mention this at all, but it's a superb organization, superb resource for benefit advisors. So go to cgib.ca. One of the things that they have going with this particular association membership, and I think it's a few $100s to join the association, but they have a Slack channel, and the Slack channel is incredibly powerful. It's an incredibly powerful channel. You can ask any question you want about, LTD offsets I was reading about yesterday, or renewals, anything you want. But it's a fabulous, real-time kind of chat room for benefit advisors, and they've got a couple of different categories. But one of the things that a gentleman by the name of Chris Gorey has done, Chris, I'm not sure if you're on this call, I think you're on the last one, but a shout out to Chris Gorey. He has put together on that Slack channel a spreadsheet, an Excel spreadsheet with all of the different telehealth providers on it, sort of the advantages and disadvantages, and he keeps it up to date. And that's just a service that's available to anybody that's on the Slack channel. And in order to be on the Slack channel, you got to be a member of CGIB. Just for that reason alone, it's almost worth joining CGIB just because of the value that it creates. So thanks, Chris. A big shout out to you and Dave for making this possible. But check it out. There's lots. It's a fabulous resource. And telehealth is just one of the resources that are available up there. But again, telehealth, no waiting for medical assistance. No waiting for medical assistance. It's as simple as that. You can talk to a nurse practitioner right away. You can talk to a doctor. They'll get you a doctor's appointment right away. I've heard nothing but success stories. Another stat I read on that, which is really interesting, another stat I read on that is, and I didn't put it in here. I just read it, but I wasn't sure how true it was or not. But it's just, even if it's half true, it's amazing. Telehealth since COVID started has increased by 5,600%, 5,600%. That's how much the uptake is. If you're not aware of all of the details about telehealth, you ought to be. It's important to be, because your clients are going to ask you questions about this and you need to direct them accordingly. Right? Telehealth is something that's there. If your clients aren't aware of it, they need to be aware of it. It's as simple as that. Employee assistance programs, much like wellness programs, employee assistance programs are a little bit different, but you need to get employee buy-in. They need to be aware of these types of programs. Lots of online services available. You can look at it through your smartphone, obviously online through your computer and so on, but there's great EAP programs available. Entry-level programs to comprehensive programs are certainly available, depending on what your client's mindset is, where you want to sort of fit within the box. There's a lot of LTD providers that provide a very, very small entry-level opportunity to go with their long-term disability benefits, to, again, extraordinary comprehensive programs that are certainly available. So make sure you're aware of those as well. And generally speaking, these are pay per employee per month. Pay per employee per month. And one of the things that's interesting as well is, you find a program that works for your client. You ask your client these future-based questions. You find the program, whether it's wellness or whether it's a telehealth program or an EAP or the prescription we're going to talk about in a moment. You find these programs that are available, and yeah, ask the insurance company if they can bill for it, if you can link it on, and often they can't. And that's where we as a third-party benefit administrator come into play. Hey, great, we can link this onto your program and add it to your bill. So we can add it to your bill, so you're still writing that one check. There's an administrative advantage. The other big advantage about compared to the wellness program, an EAP program is completely confidential. One thing that is we're talking about mental health. Mental health, a lot of people are still uncomfortable talking about it. So it's very confidential. They can talk to somebody, the individual can talk to somebody in confidence about their experiences and what they're going through and how they're doing and how to improve their mental health. And they can do that, with complete confidence because it is confidential. So that's an advantage of an EAP program. It's also a proven benefit. EAP programs have been around for a long time. So what's happened is as I mentioned, is these benefits really have accelerated the uptake because of COVID-19. Personal prescribing, something that's very interesting, something that's extraordinarily interesting, and there's a number of personal prescribing opportunities that are available in the marketplace. Personal prescribing is a brand name for one particular one, but there are a number of these opportunities, some of which I've been in touch with and gone through the process with them. And they're really evolving, and they're evolving very quickly, and they're honing their services very, very quickly, and it's a result of the increase in their subscriptions, if you would, but it's also an increase in demand because of the COVID-19 pandemic and so on. What personal prescribing is, it's really a prescription medication or medicine capability test or compatibility test, pardon me. This is a relatively new service, but it's gaining popularity. 5 years ago, this service was available, and you used to have to pay thousands of dollars for it. So you would take a test to see if there's a compatibility to the prescription drug that you are being prescribed and your body and your makeup. So it's gaining popularity now. Now you can have these tests done for just a few dollars a month, providing you buy all of the employees buy it. It's per month per employee kind of service. They're also available, sort of over the counter on a one-off type of scenario, but it's again a lot more money. But these compatibility tests are becoming more and more powerful today, especially because of COVID-19. COVID-19, you don't want to be going back and forth and trying new meds and trying different meds and come back for a test, come back for a test, come back for a test. As a result of that as well, physicians are becoming more accepting of this type of service. Slowly, but they're becoming more accepting of this type of service and the reports that you give. And it's interesting, I've got a son, I've got 3 sons, and one of my middle son is dealing with some fairly significant mental health issues and addiction issues and so on. And I'm not embarrassed to say it's just the way he's wired and the way that, the cards that we've been dealt. But we've used this type of service for him, and it's made a world of difference. Because we used to historically try medication and then it wouldn't work, and then you'd have to go back and forth, and it was very frustrating for an individual that's struggling. All of a sudden, we tried one of these personal prescribing tests, the compatibility tests, and it's a simple saliva test, and you send it in, you get a report back. We took that to our physician, and the physician was extraordinarily accepting of it and prescribed a particular types of medication to help my son, and it made a significant improvement in a very short period of time. So physicians are certainly becoming more and more accepting of these types of services. They've certainly got a more open mind, without a doubt. So it gets you the help that you need quicker. It works very well, and it works very well with mental health related diagnoses. When you've broken your arm, there's an x-ray, and they can, manage the ailment, the broken arm. Mental health, it's all above the neck, and you can say, hey, it's not working. It's, I got voices in my head, whatever the circumstances are. This is just an opportunity to help people deal with mental health quicker and get them mentally healthy quicker. So again, it depends on where your client's mindset is, but some of these services can be extraordinarily powerful add-ons to an existing employee benefit program. Other services, well, I'm getting emails on a weekly basis. There are more services coming weekly, without a doubt. There's, specific ones to do with mental health. There's specific ones to do with addiction. There's specific ones to do with cancer. Like, there's more services coming weekly. I'm getting inundated with, hey, you got to check out our new service. The key thing is to keep your ear keep your ear to the marketplace. And it's about adding value to your clients and prospects. And all of these things are available, certainly online. Regardless, it's time to have the conversation with your clients and prospects. There hasn't been a better time. As every day goes by, there hasn't been a better time. This is going to take a long time to solve. And I'm not talking about COVID-19. I'm talking the after effects of COVID-19. This is going to take a long time to solve. So when we look at the future ahead, when we look at where your clients are going, when you look at where your clients are going, and you're looking at where they're going because you're asking them these important questions, right? You're asking those future-based questions. When we look at the future ahead, it's got to be about the future. It's not necessarily about the past. We started off this conversation today about saying happy anniversary. We looked at the past very quickly, and then now we're moving on to the future. It's asking that future-based question, and it's about getting ahead of the curve. It's about really getting ahead of the curve. And it's interesting, fish swim in schools. All fish look the same, or do they? Just ask a fish, right? Be a leader of the school. And it was, it's about being a leader. It's about being a leader of the school. There's thousands of fish that swim in the school, but there's one that's kind of leading the way. And adding value to your clients and prospects, it's easy to do during COVID-19. But the fact of the matter is we're still finding today that many advisors are not advising. It blows my mind. Advisors are not advising. Be the leader of the school, right? And start advising your clients. And how do you do that? Is by asking future-based questions. If you truly want to advise your clients, you got to know where they're going. Ask those future-based questions. Mr. Client, Mr. Prospect, if we were meeting here 3 years from today, what has to have happened for you to say it's been the best 3 years of your life? Honestly, folks, I ask this question all the time in meetings. It's amazing the results I get. I keep on harping on this, but this is, I think, the key, understanding where your client is going in the future, or your prospect is going in the future, to really create a foundation of a relationship that is powerful. I like to say, try it on your spouse, your partner, your friends, your children. Try it on somebody else first. It's got to be able to be a very natural question. It's got to flow off your tongue like it's just, hey, how you doing today? Hey, if we were meeting here 3 years from today, Jimmy, what has to happen for you to say it's been the best 3 years of your life? I asked this question at dinner parties when we used to have dinner parties. I remember sitting with a group of friends, and we were at a restaurant, and there was sort of all the girls sitting at one end of the table and all the guys sitting at the other end of the table, and drinks are flowing and wine and so on. And I said, hey guys, let me ask a question. If we were meeting here 3 years from today, having dinner at this particular restaurant, what has to have happened for you to say it's been the best 3 years of your life? And it was fascinating. These are my buddies. These are guys I've hung out with for years, I've traveled around the world with. We're at a restaurant in Aurora, and I asked this question. We had a 45-minute, hour-long conversation. And they were going, this is the most powerful conversation I've ever had. It's amazing. I asked my son this question with two of his university buddies once around the campfire at the cottage, right? And it was amazing the results that you get. It's amazing. 90-minute conversation, but like the discussion that you get going, and people think about things differently, and they're thinking about the future, and they're thinking about what behaviors they have to make that future the best. One of the things that people are saying is, hey, what are how is COVID-19, blah, blah. Hey, living my best life. You know what I mean? It's because they're thinking about the future and going in the direction in which they want to go. The answers will absolutely amaze you. And how you do that is by asking the question, and you find out what's important to them by listening. You find out what's important to them without a doubt by listening. And as I like to say, deliver and implement a program that will help them get to where they're going. It's as simple as that. Deliver and implement a program that will help them get to where they're going. It makes the sale really easy. If you know where they're going and you show them how this program is going to help them get there, it's going to help them overcome those bumps in the road. It's going to help them get there. The sale becomes extraordinarily easy. As I like to say, it's important to report back on the outcomes. Not only do you have to implement programs, it's important from an advisor's perspective to report back on the outcomes. We successfully launched the EAP program to all your staff. 84% opened the email. 75% watched the introductory 4-minute video overview video. Right? Report back on the outcomes. This is easy to do. Hey, the telehealth email was sent out to all employees. Here are some of the quotes I received back from the employees. Right? Here's another example. We started the wellness program 3 weeks ago, and now 67% of your employees are participating, Mr. Client, Mrs. Prospect. 67% of your employees are participating. You know, remind the employees of the programs available to them again and again and again. What we're talking about here, and it was interesting because one of the conversations I had after the first time I ran this seminar and talked about this is, how do you do that? Well, it's easy. It's email, and you can have an email program that shows the number of opens. You can have an email program that you can communicate this stuff with the employees and track the number of opens. It's about utilizing technology to your advantage to help you help your clients get to where they're going. It's as simple as that. There are people that are advanced at this and people that need help. If you're one of those folks that needs help, find someone that can help you. It's as simple as that. It's important, right? You got to be able to report back. Newsletter, email blast, video booklet. Video booklet. Create a video booklet, right? Create a video booklet. Create an email blast that you send out to all of your employees that are all of the employees that are clients of yours. Send out an email blast. Hey, don't forget about your EAP program. It helps people, in these areas. And, real quick, real easy. Hey, this is important. Here's my email blast about benefits. I better open this up, as the members say. Create a newsletter. I know some of you are doing newsletters. We've been doing the Trusted Advisor newsletter, as I mentioned, for 102 months. These are all excellent things to do. Video booklet. So easy to do on your laptop computer. Set up an appropriate microphone, set up a light, and do a video booklet. Talk to people about what it is that you can do and how you're creating value for them. Sidebar, great prospecting tools. Show examples of tools in your toolbox. When you're talking to a prospect, Mr. Prospect, Mrs. Prospect, this is how we are going to talk to your clients. We use this email blast program. With everybody's email, we can blast them about their benefits on a continual basis to remind them of the EAP program. We can remind them of the increase we just made in mental health benefits, because it's really important right now. Hey, we're going into another lockdown. Let's remind everybody about telehealth, right? It's just a blast, but it's a great example of how you can add value to your prospects. Show them, show your clients what it is that you're doing for other clients. In putting together this presentation, and this is something that I came up with. I didn't get it from anywhere else, but it's about adding value. Mental health, COVID-19, employee benefits. It's really about adding value to your clients. And value is added when you help someone get to where they're going. I've been in presentations for the last 30 years in this industry, and everybody's talking about adding value, and they're showing you examples of how to add value. The thing that I learned in putting together this presentation, and what's really resonating in my mind, and I sort of came at it backwards, and I'm still learning after 30 years, is value is added when you help someone get to where they're going. Value is not added if you're giving them a shopping list. That's not adding value. Value is truly added when you help someone get to where they're going. Let me give you an example. If your tank is full of gas, your car is full of gas, and you're providing a quote on gas, really doesn't add a lot of value. Well, that's really good. Thank you, Mr. Advisor. I'm really a bit long on gas right now, and I got an easy access to the gas station right around the corner, so that's really not a value to me. Selling your client a roadmap is of little value if they have a GPS or a smartphone. Just about all cars right now, or all luxury cars right now, if you would, have a GPS built into their dashboard. All right, everybody's got a GPS on their smartphone. They've got Apple Play coordinated somehow. I don't know how it all works. My sons do, but hey, can I show you a roadmap? No, I'm all right. I know how to get there. I got the tools available at my fingertips. But delivering air for your client's tires is full of value if they don't have any air in their tires, right? How you do that is by asking future-based questions. Mr. Prospect, where is it that you're going? Well, I want to go, I want to drive from here to there. You got enough gas? Yeah, I got enough gas. Terrific. Do you have no directions? Yeah, but really what I'm short on is air for my tires. We can deliver that. I'm going to deliver air for your tires. I'm going to have it in the underground parking for you, so when you go down to use your car, it is ready. You got to understand where the client is going, and then you got to help them get there. Ask meaningful future-based questions, and you can help your clients and prospects get to where they are going. How can I help you get where you're going? It's as simple as that. Value is added when you help someone get where they're going. It's amazing. And when you say to a prospect, hey, it's really great. I've been doing this for 30 years and I've got my access to the entire marketplace. And let me do a market survey for you to see if I can save you 10% of your premiums. Guess what? Heard that one before. Your prospect and client have heard that many, 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 many times. And you know what? That maybe not where they're going. They're looking to survive over the next couple of months to the end of this pandemic. They're looking to grow. They aren't interested, especially now, in changing their benefit plan carrier, without a doubt, because it just doesn't make a lot of sense right now. It may not make a lot of sense. It may not be where they're going. It's better to ask them where they're going before you offer a solution. This solution doesn't work, and it hasn't worked for many years. The mental health employee benefits discussion is top of mind with many successful employers. It is without a doubt top of mind with many successful employers. It's as simple as that. As I mentioned, you can't pick up the newspaper. You can't look on your phone. You can't put on the 6 o'clock news without talking about COVID and mental health. You can't. It's impossible. All we talk about is COVID and mental health. 50% of the population is not doing well from a mental health perspective. Guess what? It's time for you as an advisor to have these conversations because they're top of mind and help your clients get to where they're going, without a doubt. So we've been talking for 56 minutes. We've talked a lot today. Put mental health benefits in its own silo, have the discussion, separate yourself from the rest, be the leader of the school, without a doubt. Make mental health meaningful, mental health benefits meaningful, especially today. You will be able to, your clients will look at you differently. They'll look at you as a trusted advisor. They'll look at you as a valued part of their team, even more so than they have in the past. Link additional programs and services, lock in the client, simple administration. We talked about that. And, ask great questions, ask great future-based questions, match the services to the client's mindset, help them get to where they're going. Again, gas, direction, tires. Really, it's about asking them where they're going and helping them get there and helping them overcome those bumps in the road. Get ahead of the curve, add real value. And I'm amazed at people that have not, advisors that have not done this with their clients. We're in conversations on an ongoing all the time. We're in conversations all the time with prospects and advisors, and we're able to come to meetings like this through Zoom and help you out where needed. And it's just a powerful, powerful way to have conversations. Find out where your client is going, help them get there without a doubt. Happy to have a conversation with you because you know what? I want to find out where you're going. One of the first questions that I'm going to ask you is if we were meeting here 3 years from today, what has to have happened for you to say it's been the best 3 years of your life? I'm going to ask you that question. I'm going on a call at noontime today with another new advisor, and I'm going to ask her that question as well. So we want to help you get there. We've got lots of tools available to help you get there. We've got lots of flexibility in our solutions. Visit thebenefitstrust.com. Check it out. Lots of valuable information on the website that can help you get to where you're going. We're going to sign you up for our newsletter if you're not signed up for it already. We're going to send you a copy of your CE certificate shortly. We're also going to send you a very short survey. Please fill that out and let us know how we have done. In addition to that, we're going to reach out to you very shortly and say, hey, thanks a lot for participating in our webinars over the last little while, and if there's anything we can do to help you out. For doing business, thank you for doing business with us. If we're not doing business, we'd love to do business with you, and we most importantly wish you continued success in your journey, moving forward, continued success in your journey, and we want to help you get to where you're going. Simple as that. Hey, wishing you happiness, good mental health, and we're wishing you success in the future. Thanks for your time. Visit our website, find out more information about things that we're going to be doing in the future like this. We're also going to communicate with you via email and our Trusted Advisor newsletter. Make sure you read it, but wishing you health, happiness, remain safe, and good selling. Bye for now.